Hello, everyone, and welcome to the Strength and Hormones podcast. I'm so excited for another guest interview today. Today, I have the pleasure of interviewing Christian, and he is with the company Micro-immunotherapy. And really, this is a treatment that is utilized with a lot of practitioners that are practicing in the central area of Europe. Their lab is based in Mallorca, Spain, and Christian is based in Spain. And he's going to be sharing with us some of the just amazing powers of microimmunotherapy today as it relates specifically to autoimmunity and Hashimoto, since we have such a large portion of our listeners that are dealing with autoimmunity. And so, really excited for you guys to learn a bit more about microimmunotherapy and all of the amazing benefits of it. So, Christian, thank you so much for being here and welcome to the show.
Thank you very much, Laureen. Thank you for this introduction and thank you for the invitation to be with you in this podcast today. And it will be a pleasure to explain some of the features of microimmunotherapy to your listeners.
Yeah, I'm really looking forward to it because I stumbled upon microimmunotherapy sometime last year and was just really blown away by the powers of it and, just how it works and how it can be so powerful for a breadth of different conditions, but especially those that are rooted in the immune system. So I would love for us to just start off by just introducing like what is microimmunotherapy and how does it work?
Microimmunotherapy is basically an immunotherapy using immunomodulatory substances in low and ultra low doses. It uses these substances in order to send messages to the immune system and in order to retrain it to be efficient and to be working in a natural and healthy way again, and to correct any disbalance or burden that might be in the immune system. We are using such substances as, for example, cytokines, growth factors, and other immunomodulatory substances in very small concentrations. And that is very important because we are using the substances in the physiological range in which they are used naturally by the body. And we are using these substances in a way that they do not have any toxic or negative side effects. It's a very gentle and yet efficient treatment for the patient.
Absolutely. And I think a lot of patients might be familiar with immunotherapy, especially if they've ever dealt with environmental allergens and things. In the States, at least, immunotherapy is used a lot for helping individuals
Mhm.
overcome environmental allergens to help reduce that histamine response that's occurring. So, could you explain what would be the differences between regular immunotherapy and then microimmunotherapy?
Well, the main difference is that we are using our active substances in the range of nanogram, femtogram, picogram, so very, very low concentrations, which still send an informational impact, but do not cause any negative effects. As opposed to that, the regular immunotherapy uses active substances in the range of gram or milligram, which is a lot higher concentration. Another significant distance is that microimmunotherapy uses compounds of active substances. That means not only one substance, but a whole combination. And that is due to the fact that also in the immune system, there's a whole orchestra of different substances that are implicated in an immune reaction. And we are mimicking this with our compound compositions. And also, there's another important difference, and that is the sequentiality of the treatment, because an immune reaction is divided in different stages, different steps that happen at different times. And it is important to reflect this timely differentiation of events by the composition of the formulas. And so our treatments are sequential. That means that we are giving a slightly different composition of active substances to the patient every day in order to mimic this timely sequence of events. So it's a very natural and I would say biological way of treating patients.
Hmm. Yeah, and I'm glad you mentioned that because there is this sequential dosing, right, where the patient does really need to follow the making sure that they're taking, the first dose before the second dose, before the third, and so on and so forth for that reason. And from my understanding, too, one of the differences with microimmunotherapy is that because the dose is lower, that it mitigates a lot of the potential side effects that can come about with immunotherapy because the dose is much more drastic in the way that it can influence the immune system. Is that correct?
Exactly, that's correct. The low dosage is in an almost physiological way. That means in the same concentration or almost the same concentration as those substances, those cytokines are used naturally from the body. And that makes sure that there are no negative effects because our immune system is using these substances naturally every day without any negative consequences in the same concentrations. And for the patient, it is important that microimmunotherapy treatments are presented in blister packs, and these blister packs are clearly marked with ascending numbers from 1 to 10. That makes it easy for the patient to always follow the right sequence and not to take it in the wrong way. And that helps to have a good compliance with the treatment.
Yeah, can you talk a little bit more about the differences in the sequential dosing? So, when someone's taking blister pack 1, for example, what is the difference between blister pack 1 and blister pack 10?
Well, there is no difference between the different blister packs. They are completely identical. You can consider one blister pack as a complete message to the immune system from 1 to 10. So, and by taking several blister packs in a row, you are repeating the same message over and over again. And that is another important feature of microimmunotherapy. Through repetition, you get a training effect. You can put the immune system again in a natural way of functioning by repeating the same immune message over and over and over again. It works like a lesson in school when you learn a language or whatever, or it works like a workout unit in the gym when you are training. With just one training unit, you won't have an effect. But if you repeat the workout over and over again, you will have your training effect. And that's what microimmunotherapy does.
Yeah, it sounds almost like what we call progressive overload, where you're, consistently just overloading the muscle a little bit more, right? So that it continues to build stronger and stronger. And that's essentially what we're doing to the immune system with microimmunotherapy. And as we mentioned earlier, microimmunotherapy can be so beneficial for a lot of diseases that are rooted in the immune system, which virtually is every disease, right? Because the immune system really
Mhm.
controls all of the
Exactly.
inflammatory response. But as we're talking more specifically just about autoimmune conditions, can you tell us just briefly what exactly is happening with the immune system when there are autoimmune conditions happening, and where can microimmunotherapy fit in to help support that immune response?
Well, basically, when an autoimmune condition happens, that means that there is a lack of tolerance in the immune system, and that the immune system is overshooting. It is reacting too strong against own structures of the body, against own cells of the body, organs, or whatever. And basically, what microimmunotherapy does is dampening this overshooting immune reaction, calming things in the immune system down, and also dampening inflammatory processes because mainly autoimmune diseases are going together with a lot of inflammatory processes, but not positive inflammation in the sense of defending the organism against pathogens. It's an overshooting inflammation which is harming own structures of the body, and that needs to be dampened. And basically, microimmunotherapy teaches the immune system to be more tolerant and to calm things down.
Mhm.
One important thing about microimmunotherapy is always that we are seeking homeostasis. Homeostasis means a natural balance of things, a healthy balance. So if I say we reduce inflammation, that means that only reducing the harmful peaks of inflammation, but not eliminating the capacity of the body to produce the necessary inflammation in order to fight against bacteria or virus. So it just takes out the too much of the immune reaction, but it maintains the necessary.
Mhm. Yeah, and I almost think of it as a scale, right? Where you have like immunosuppression, so the immune system is suppressed, and then like immune controlled or regulated right in the middle, and then kind of this like
Mhm.
hyper functioning immune system, and autoimmunity being in that more hyper functioning like, immune overdrive, right? And then it sounds like microimmunotherapy is really working to bring that individual from that high end of the range kind of back to that middle, right? So we're not creating this like immunosuppressed state, we're just bringing them back to more of an immune regulated state from them body being in this overdrive and this attack mode. Is that correct?
Exactly, that's absolutely correct. And there is another way that we can help with autoimmune diseases, and that is through addressing certain cofactors. Microimmunotherapy is very good in treating, for example, viral reactivations, and often autoimmune processes are triggered by viruses that have escaped from the control of the immune system, and that is causing an immune dysregulation, which finally leads to an autoimmune state. And so, when you address this viral reactivation and you put the virus back under control of the immune system, you take away the trigger, and that also calms down the whole dysregulated immune reaction. So that is also an important feature. And that is a level of microimmunotherapy where we use specific blood tests in order to assess the exact situation of the immune system, see exactly where the burdens are, where the imbalances are, and then address them in a very fine-tuned and targeted way.
Yeah, and I think that's important because we know that such a large percentage of individuals with Hashimoto's, and for example, it's triggered by Epstein-Barr, which is a virus. And so you're talking about,
Exactly.
if there's been viral reactivation of Epstein-Barr, because once you've had it, it's dormant in the body, hopefully, and then it can get reactivated. That microimmunotherapy can put that reactivation back into deactivation of the EBV. And so when we're thinking about microimmunotherapy, it's not just about how it's supporting the autoimmunity, but also maybe the root causes of the autoimmunity, right? Or some of the side effects and symptoms of the autoimmunity. So it can work in multiple different facets. And one of those that I know you guys talk about quite a bit is this idea of what we call mitochondrial dysfunction. And this is something that I think is such an underlooked aspect to why people aren't getting better, because our mitochondria really are, what's generating energy for all cellular processes. So can you talk about just outside of the viral activation piece, how microimmunotherapy can also function to support mitochondrial dysfunction?
Well, we have a specific formula for the support of mitochondrial function. And what it basically does is enhancing the ATP production of mitochondria, but it also reduces oxidative stress on cells and it has an overall resetting, rebalancing effect on the immune system. And this particular formula has been very useful in the last couple of years because of so many patients suffering from long COVID, post-COVID symptoms, especially unexplainable fatigue, a tremendous lack of energy, lack of mental focus, brain fog. And there, this microimmunotherapy formula, it's called MyRec, has been especially useful to help these patients to gain their energy back and to overcome this long COVID symptoms.
And do things like the Myrick formula, are they being used for an acute period of time, but they're having a chronic effect and how they're kind of rewiring like the cellular information in the body? Or is this something where if someone's seeing benefit that they should continue with the microimmunotherapy long term?
Well, usually, for example, if you are treating a patient suffering from long COVID, post-COVID, the average treatment duration would be about 4 months to 6 months, I would say. And then usually you should be back on the track. But once again, the specific lab testing helps to evaluate exactly um, how damaged the immune system is, where the imbalances and burdens are. And that also helps you to determine how long the treatment has to be, because sometimes you have to insist a little bit more in order to get a sustainable benefit in the long term. And so treatments from time to time can also have a duration of 9 months, 12 months, or even longer, really depending on the individual clinical situation.
Yeah, and I think that's a good point to bring up because every patient is unique. And so, although there might be these estimated timelines,
Mm.
like you're mentioning, someone's body might not respond with that timeline. And so, just like with any type of treatment, it always is fluid to labs and symptom changes and things and the patient's progression. So, we talked a little bit about how microimmunotherapy can work on mitochondrial dysfunction and on viral reactivation, which can be issues or triggers for conditions like Hashimoto's. But are there other types of therapeutic targets of microimmunotherapy that are outside of those that are specific to Hashimoto's in particular?
Well, the treatment of autoimmune diseases offers several levels of intervention. The first level of intervention would be addressing the hyperreactivity of the immune system, the overshooting inflammation. That is always the first step. Then you look into, as I said already, other cofactors, like, for example, viral reactivations that can be addressed and that can take triggers out of the autoimmune situation. And then there are a lot of very specific interventions specifically for autoimmune diseases. You can, for example, use autologous blood nodes in order to um, teach the immune system to be more tolerant with self structures by by confronting the immune system with self structures. You have the possibility to create specific remedies based on the autoimmune antibodies in a down-regulating dilution in order to down-regulate the expression of these autoantibodies. And you can even do a specific testing of the HLA DLR3, which is causing this type of auto Graves' disease and Hashimoto's. And you can even downregulate the genetic predisposition of this clinical condition. So you have really a lot of different interventions. I would say that autoimmune diseases are really the um, most complex field of using microimmunotherapy, because it has a lot of different levels and a lot of different possibilities to intervene.
Wow, that's fascinating about the HLA antibodies. I didn't realize that because we actually had a podcast interview. I think it'll go live before this one, where I interviewed Dr. Kalia Waddles, and we talked about secondary infertility because the HLA antibodies
Mm-hmm.
are something that are implicated. They increase the risk for secondary infertility, and because the body kind of thinks that the baby is like a foreign object, right? And the immune system denies that the fetus. And so you're saying that with the microimmunotherapy, there's a way to be able, if someone does have positive HLA antibodies, there's a way to be able to kind of suppress the HLA antibodies from wreaking havoc on the immune system. Is that correct?
Exactly, but you have to do specific remedies using these autoantibodies or using the HLA antigens in order to produce a specific remedy in C27 in order to downregulate particularly this specific antigen or this specific gene you want to downregulate.
Mhm. Okay. So it sounds like there's almost a three-prong approach then for something like Hashimoto's, where you mentioned kind of getting the immune system out of this like hyper overdrive, right? And then putting something like viral reactivation into deactivation, if that's potentially going on. And
Hmm.
then third would be kind of
Hmm.
targeting more of these like specific things that this patient might be experiencing, like the positive HLA antibodies, mitochondrial dysfunction, and such. Is that correct?
Exactly, that's correct. And the first two levels of intervention can be done with complex compound medicines, which are already fabricated. And the more specific and targeted and personalized treatment has to be produced really personally according to the findings of this specific patient. That is something which is not standardized, where you have to really personalize a remedy.
Okay. Okay. Amazing. And are these all of these types of remedies at every level of microimmunotherapy? Are they things that can be safely combined with different pharmaceuticals, herbs, vitamins, and such?
Yes, microimmunotherapy is all the time combined with all sorts of treatment, both from the allopathic medicine and also from integrative medicine. And it's also combined with all sorts of nutritional supplements. So it's really a very flexible therapy which can be combined with everything, and there are no contraindications. And also, in 30 years of clinical history of microimmunotherapy, there are no adverse events that have been reported, or no toxic or undesired side effects. So it's really a very safe and gentle and well tolerated treatment.
Mm. Wow. And what are some of the, I guess, success stories or some of the main outcomes that you've seen with patients or that practitioners have reported with their patients that are on microimmunotherapy?
Well, basically, the most amazing success stories relate to patients suffering from unexplained chronic fatigue, because these patients are often bedbound, housebound. They have not been out of their homes many times for years, and they have had a long journey from doctor to doctor, from treatment to treatment, and finally, yeah, really you can say they end up trying microimmunotherapy. And as microimmunotherapy really is looking for the root cause of a disease, and really looks into the individual condition of a patient, it often has amazing successes with yeah, bringing these patients back into life and giving them back their energy and their happiness and their capacity to regain activity. And that is really, these are the most important success stories. And another field that I would like to point out is kids with neurodivergency conditions like autism and pandas, etc. And they are also having very good results. And that is really life changing also for the, not only for the children themselves, but also for the families who really have the impression that suddenly they have a different child.
Yeah, really life changing, I think, is a great way to describe it, of giving someone their life back, right? And that ability to just be able to go about daily function in a way that maybe they haven't for many, many years. Is there any type of situations where you don't advise use of microimmunotherapy? I'm thinking like situations like pregnancy, or if someone's like going through cancer treatment, or if maybe they're in an acute flare with an autoimmune disease. Is there any contraindications?
Well, the only real contraindication is for organ transplanted patients. They are advised not to take microimmunotherapy because you have to avoid any kind of stimulation to the immune system. In pregnancy, you should avoid it like in the first 4 months approximately, but it can be taken after a risk benefit analysis in the last part of the pregnancy. If it's always a decision if the mother is really suffering and there is a strong medical indication which makes necessary an intervention even during pregnancy. But if you say it can wait until she has given birth, it's always better to wait and to avoid any kind of problem. Not that there is any bad experience, but just for safety reasons.
Mhm.
Um, as opposed to that, microimmunotherapy can be used, for example, in breastfeeding mothers during breastfeeding. That's not a problem. It can be used for infants. It can be used for elderly. And regarding acute flares, you can take it during acute flares. You should just step up the dosage in order to put the immune system in a condition to tackle this acute flare. That also goes, for example, for acute herpes flares, which is a beautiful application of microimmunotherapy, that during an acute flare, you step up the daily dosage to 4 capsules in order to tackle the situation, and then you continue just with the standard dosage of 1 capsule. And you mentioned cancer treatments. It is even important to continue with microimmunotherapy or to take microimmunotherapy during the cancer treatment, like chemo, radiotherapy, or immunotherapy or surgery, in order to sustain the immune system, to create the most hostile environment possible for tumor growth, and in order to improve the quality of life, especially when the patient receives chemotherapy.
Mm. Wow. And is this all happening through the cellular response of essentially like bringing the cells back into homeostasis, like you mentioned? Or is there some other type of effect that microimmunotherapy is having on the body, whether that's like some other type of biological, hormonal type response?
Well, basically, everything works through the immuno communication. That means that a specific message is sent to the immune system in order to regulate in a specific way. But of course, there are also other fields where you wouldn't expect an immune reaction in the first place. For example, neurodegenerative diseases can also be addressed with microimmunotherapy, and the formulas used in that field, um, they have on one side quite a vast range of inflammatory cytokines which downregulate the harmful and destructive inflammatory process. But on the same time, they have neuroprotective factors and neuro regenerative factors which help the nerve tissue to grow again and to sort of recover their neuroplasticity and their functionality once again. So it's really a two or threefold approach, acting on different levels at the same time.
Wow. So you're talking about conditions like Alzheimer's and dementia and such. Is that right?
Exactly, yeah. Multiple sclerosis, Parkinson's,
Mm.
dementia, Alzheimer's. Yeah,
Yeah. Yeah, and I think that the immune system is an overlooked area for any condition and disease state. Oftentimes it's only thought about in conditions like cancer or maybe sometimes even autoimmunity. But I really feel that even often autoimmunity, the immune system goes unaddressed. That because it's kind of told to patients that this is just what you are, the cards you've been dealt with. There's nothing you can really do about the autoimmune state and about the symptoms that you're currently experiencing. But, as you're alluding to, and as we've talked about, the immune system is implicated in really every disease process because that's where inflammation comes from,
exactly.
is from this immune response. And so we talked a little bit about mitochondrial function, and you touched a little bit on like long COVID and these viral, reactivations that can be implicated with autoimmune disease. But what about some of the symptoms or side effects? So, like one of those, for example, is this like chronic histamine and allergic response that a lot of people with autoimmunity deal with because their immune system's in this like hyper overdrive state, right, where it's constantly producing more and more histamine. How can microimmunotherapy help support someone who is experiencing a histamine intolerance or experiencing issues like hay fever and seasonal allergies?
There is a very good way to addressing this kind of patients. There is a specific formula which addresses the Th2 reaction and which basically dampens the histamine production and the overactivation of mast cells. And we have very good results with this kind of formula, and especially nowadays after COVID, there are many patients who are suffering from something called mast cell activation syndrome, and they profit enormously from this formula in order to calm down the mast cells, to bring down the production of histamine, and to reduce the symptoms these patients are suffering.
Yeah, that's mast cell activation is really, it impacts a lot of people, especially like you mentioned, even more now. And I'm curious, just from a historical perspective, how did the scope of microimmunotherapy change with COVID? I'm sure things were a bit different than they are now post COVID. Is that correct?
Absolutely. Really, for us, the world has changed completely with COVID. First of all, because the conscience of the general public, but also the healthcare professionals and the patients on immunity has changed completely. I think COVID really has opened the mind of many people that the immune system is very important, and that it's the guardian of our health, and that we have to actively support the immune system in order to stay healthy or regain health. And on the other side, we are confronted with I would say, um, unusual reactions of the immune system after COVID. It's sort of gives the impression that somehow immunity has changed, and the way how people usually have immune reactions, and that brings up a whole new set of clinical pictures which need to be addressed. And many doctors are seeking support in this kind of clinical situations, and they find microimmunotherapy a very useful tool for that.
Mhm. Yeah, and unfortunately, there's not too many out there. In the allopathic community, there's really not a lot of ways that patients are being supported that are dealing with long haulers and long COVID or post COVID. And so, microimmunotherapy, I think, provides a promising treatment option for those patients that have been struggling for years at this point.
Exactly. Yeah. And it's not only a very targeted way of treating, it's really going to the bottom of the problem, and it really attacks the root causes of a disease, because many times you see one symptom which yeah, it's just a symptom, but it's not the cause of what is happening. And when you go deeper and you really address the underlying factors, then you get a long-lasting result, and a really reliable result.
Mhm. Yeah, yeah, that's the root cause is always where all of the long-term change happens, right? Because if you just treat the branches at the top, then you might feel better for a couple of days, couple of months, but it's not going to be something that's really gonna provide much chronic and long-term result.
You are absolutely right. And microimmunotherapy offers this several layer approach. We can address the main symptoms, the symptoms which are, let's say, on the surface, but we also have possibilities to look a lot deeper and to define more personalized and more specific strategies, and to get a more long-lasting and long-term treatment results. So it's really something that can be used on different levels, in different interventions, and I think it's very useful for patients and for healthcare professionals.
Definitely. I'm excited to talk more about it. And I'm really grateful for you for coming on today to just provide more of your knowledge and experience. You've been working in this field for over 20 years. And so I'm sure you've seen so much and seen so many great outcomes of microimmunotherapy too. So I really appreciate everything that you've been able to share with our listeners and all of your wisdom today.
Thank you very much for the invitation, Lorraine. It was a pleasure talking to you.
Thank you.